With more on what the premiers are asking for, we're now joined by the Premier of New Brunswick, Blaine Higgs. Premier Higgs, good to see you. Thank you for joining us.
You're very welcome, Michael. Nice to be here.
Now, you and your counterparts are asking for more funding. The federal government says it's willing, but they also want, I guess, more accountability and transparency. Are the premiers willing to meet that condition?
Well, I think right now we're willing to have that discussion, to meet and face to face and work through the details. You know, this has been going on for 2-3+ years, and healthcare, as we've come out of COVID and still struggling in every healthcare facility in the country, it's a universal problem for us, and I think that every premier in every province, every territory, are saying, let's meet. We're asking the Prime Minister to meet with us, and let's discuss all the items. Let's talk about funding models, but let's talk about how we get better health care. I don't think any of us are afraid to talk about how we get better. It's our responsibility to be better in our respective provinces, and we don't take that responsibility lightly, and we own that, and so but we all agree our healthcare system needs to improve.
Mm-hmm. Now, I think part of the disconnect for federal officials has to do with the budget surpluses that many provinces have right now. Ottawa is still dealing with deficits as it makes the current health and social transfers. Why should Ottawa go further in the hole if provinces already have a healthier balance sheet?
Well, I think that a good thing to look at would be why is the federal government running deficits? Where is the money being spent, and is it being spent on the most critical care item in the country, as would be warranted by, I would say, everyone, not only residents but certainly politicians and medical professionals alike, would say healthcare is the #1 issue. So money seems to be going everywhere for everything, but why is it not being focused on the very issue that we all agree on? And while we all may have temporary surpluses, and I say temporary because here in New Brunswick, we had unexpected growth in our province in terms of population. We've seen spending and levels increase that are unprecedented in the last couple of years. We know inflation levels are high. Is that going to continue? Are we going to see a bit of a recession following this next year? So we're carrying here like a $12 billion debt, and so that's one of the highest debt loads per capita in the country. So a deficit or surplus certainly doesn't tell the whole story, but where you're putting your money and what priorities you're putting it on, I think that does tell a big story, and that's where we need to get aligned.
Mm-hmm. Help me understand this a bit more, though, Premier, because correct me if I'm wrong here. Didn't Ottawa already top up an additional, $2 billion to the provinces, and that's above the $45 billion it is giving this year through the Canada Health Transfer? Why the need to ask for more if there was already in the summer, again, a $2 billion top-up?
Yeah, but what we're looking at here, if you take that across the country and the amount of costs that healthcare is incurred in every province, and us, in the size of our province, but usually in every province it's a 30 to 40% of the total budget. So for us, it's like $3.5 billion a year. We're looking for a sustainable ability to manage that. Out of that $3.5 million, the federal transfer portion of it would only be a percentage of that. Let's say currently we're running about 20%, 22% in that range of our total healthcare bill. So when you look at that end of it, you're saying these are reoccurring costs every year. And in a province with an aging demographic, they're only getting larger. So you're one single injection. This is the point. It's having a sustainable funding model that actually recognizing the growing costs of healthcare. And then let's talk about how we share best practices and how we can learn from each other and how we can build a better system. And we want to have that open discussion with the Prime Minister. And they've committed, Minister LeBlanc committed back in the fall when we were in BC, early fall, that he would have that meeting early in the new year because he wanted to have it in time for this budget because they were committing for funding in the budget. I'm confident if we can have that meeting early January, that we're all of the like mind to find a deal that works for everyone. And let's just get face to face in a room.
Face to face room. I'm kind of wondering if you could give us an idea of the temperature in that room, though. You know, obviously the voices were calm in the news conference today, but this is a big matter, healthcare, the largest proportion of any provincial federal budget when you look at it. What is the temperature right now amongst the premiers to sit down with the Prime Minister and have an open, calm discussion, or emotions high at this point?
Well, no, I think we're all adults in the room. It's not a case to be corner the Prime Minister all at once. It's a case, and the topic's certainly not a new topic to spring on anyone. Here are the issues, and here's what we want to speak to. No, I think we're all just very focused on having a program that we can move forward on together that recognizes what every citizen knows in our country: healthcare needs top attention, because that's where our challenges are in spades. And I don't think it's too much to ask after all this time, particularly. We worked well during COVID. We worked extremely well as a team across the country, working with the federal government. And this is just one of those items to carry on with health and say, let's find a solution. People aren't anxious for any sort of other reason that there's a sense of urgency, and we need to address it together with the federal government.
Any indication as to whether or not the Prime Minister will agree?
To have the meeting?
Yes.
Well, we've certainly said, he picks the time. We'll change all our schedules. I think you heard Premier Ford say that. We all agreed to that, in the meeting. And the idea was, if he pick a time, and it should be early in January, it should be in the first half of January, because it wants to get in plenty of time before the federal budget. But we will arrange our schedules to be there.
Premier Higgs, really appreciate the time today. Thank you for it.
You're very welcome. Have a good day.
You too.